Welcome everyone to this medicine and dentistry interview workshop. Thank you so much for coming along. I hope you're going to find it helpful. So my name's Tabby for some context, and I studied at Newcastle. I spent 3 years there doing marine biology. So not a medicine or a dentistry background. However, I now work in central outreach, and we've been trained up on all these sessions covering a range of subjects, so I can help you guys make your choices and decisions about your future options. So like I said, feel free to use the chat throughout. Fire away your questions. I'm joined by some student ambassadors who I'll introduce later on, who currently study medicine and dentistry. So we're going to hear a little bit from them too, and hopefully you're going to find it really informative. So we'll get going. Okay, so what we're going to cover, admissions policy. We're not actually going to cover that because you guys have all already gone through that and been invited to interview. Well done. A little bit on the roadmap. We're going to look at the types of interview, how to prepare for questions. Then we're going to have some practice questions, how to tackle the role play scenario, and hearing a bit from our student ambassadors as well. So just a disclaimer, although the majority of advice is useful for all medicine and dentistry schools, the details are specific to Newcastle. So it will be helpful for all of them. Just to make you aware, this is our policy, not every school. Okay, so in terms of your interview process, you have this setup of being invited to interview, attending the interview, interview selection, receiving your interview outcome, and A-level results day. So you guys are now waiting to attend your interview, which is happening between December and February. It will be in the morning or the afternoon. And of course, we advise you double check whether your interview is online, and if in person, what building it's in. Okay, so in terms of interview selection, how it works is that the interviewer will assess the applicant on the spot. The interviewer will score the applicant. So you guys, you'll be scored on certain areas, and comments will be made, and then scores are compared across applicants. So receiving your interview outcome, personal statements will be checked. High-scoring applicants will be offered a place based on UCAT, interview, and personal statement, and then your offer will be sent out in March or April. Then obviously you'll have your A-level results day. Okay, so first I want to see how prepared everyone feels for interview. So I've just created a poll on Mentimeter. If any of you guys are able, you can join online. The code's up there, 67197977. And if you could all just put your vote in for how prepared you currently feel for your interview. So 0 would be not at all. 5 could do with more preparation, and 10, I'm ready. Give us a good idea of how everyone's feeling. Interesting. We're getting a bit of a bell curve here, aren't we? Okay, yeah, so that's really interesting. We've got a whole range of responses there, which is absolutely what I expected. So some people not feeling so confident, most of you sitting in that, you feel you're not completely unready, but you could do with a bit more preparation, and then a few of you feeling a bit more confident, which I think is exactly what we'd expect. Hopefully that's reassuring for you guys as well to see that a lot of you are feeling the same. So just back to our presentation quickly. So in terms of interview types, you're probably aware of this, but you'll have MMIs and you'll also have traditional panel interviews. So dentistry is usually assessed in this way, in the panel interview format, typically conducted by 2 selectors and sometimes a layperson, approximately 20 minutes long, and can be in person or online. This year, they're all online. Our MMI is how we assess most of our medical students. It's based on a carousel setup. So we have 7 candidates, 7 stations, and 7 minutes. Okay, so our top tips for virtual interviews, which is what most of you will be attending with your panel interview, would be to test your digital setup. So make sure you've checked your equipment and connection. And I would actively, even practice having calls with friends in the exact place that you're going to have your interview. If you can't find anywhere at home that's appropriate, your school will absolutely be able to support you usually with finding somewhere appropriate. So do look into that. And make sure you won't be disturbed. I know it seems obvious, but just it can be easy to think, oh, I'm doing an interview from home, so I don't need to kind of prepare the logistics. But it will put your mind at rest if you've prepared as much as possible. Having said that, we completely understand that things go wrong and you won't be penalised if you have any issues or disruption. So don't panic if things start glitching. Remember, you're being assessed on your content, not your camera quality or your background. So, how are you going to be graded? You're going to be assessed on 7 main areas. Firstly, your compatibility with the program, your organization skills, your persistence and resilience, your motivation and commitment to becoming a doctor or dentist, your communication, empathy, self-awareness, your integrity, and your teamwork, including leadership within that. So, what's really important is that you are able to reflect on your experiences, think about what you've learned and the skills you've gained from that are relevant to becoming a doctor or a dentist. I know it seems self-explanatory, but it is often what applicants are missing out on doing. For example, work experience is a prime example. Obviously, it's amazing if you've got work experience, but what you need to imagine is that whenever you're talking about something, someone is asking you, so what? Because it's great if you've been if you've done work experience in a GP surgery, but if you aren't able to reflect on that and mention the specific skills you've gained and how that's going to help you be a doctor, there's not much point talking about it. For example, if we take this for an example, say you volunteered at a local care home. Within that, you developed empathy by empathizing with patients and understanding their worries and concerns, as well as comforting worried family members. Obviously, the skill you've picked out is empathy, and then you'd relate that to why that's important to becoming a dentist or a doctor. And what I really recommend doing is creating a reflection diary. So have a think about any experience you've got and then write down those key transferable skills you gained from it. Leadership, organization, communication, time management, anything like that. Specifically evidence how you gained those skills, what you learned from it, and how it will help you be a doctor. And I would recommend writing it in that format in a little flow chart. And if you practice answering questions in that structure, it will just help you out so much on the day when it comes to it. You could also take a different approach. It is basically the same, just a slightly different structure where you pick a skill. For example, empathy. We love empathy. You developed empathy when you volunteered in a classroom. This relates to being a doctor how. It is virtually the same, but it might be that if you've got a few experiences that you think you developed empathy, you can bring them under the same umbrella, which might help you get a bit more into your answer. But again, completely up to you how you structured these. Of course, bring it back to that role of a dentist or a doctor. So in terms of structuring your answers, we also recommend the STAR format. So situation, you want to set the scene and provide a context. So where was it happening and when? Task, describe the purpose, what needs to be done and why. Action, how did you do it and what skills did you use? Result, explain your results, accomplishments and savings. And then reflect, really critical to not miss out that final reflect point of how that links to the role of a dentist or doctor. Of course, this is just a suggested structure, but I can say even from my experience, any interview I've ever done and being in the graduate job market, this is recommended across the board. So even if you don't end up going down the dentistry or medicine route, it's really handy to keep all this in mind. Because really these days employers are far more interested in transferable skills than your technical skills in a lot of sectors. You could also use the PAR technique, problem, action and result, the ABC technique, activity, benefit and cause, and the CARL technique, context, action, result and learning. Really, to be honest, I think they're all saying the same kind of thing. It's just about making sure you provided a context, you've provided specific actions that you carried out, and then you've reflected on that to talk about the result and how that's going to help you in the future. Okay, trying out your own answers. So it's important to reflect on your own experience to prepare yourself for answering questions. We do recommend, although it's good to practice, don't script yourself answers to specific questions because often applicants do come across a little bit too scripted in their interview. Experience, skill, relate to medicine or dentistry. Can't stress it enough. Okay, medical ethics. So it's really important that you have some idea of recent medical or dental ethical problems in the media. This could be assessed in the role play situation as well as when assessing you on your professionalism and integrity. So there are four principles to think about, and I'm sure most of you will be aware of them. They are autonomy, beneficence, non-maleficence, and justice. So these pillars of ethics are really important to bear in mind when you're answering your interview questions. When we think about autonomy, we're thinking of the capacity of a rational individual to make an informed, uncoerced decision. Beneficence, the state or quality of being kind and beneficial, acting with the patient's best interests. Non-maleficence, to do no harm. And justice, doctors need to treat similarly situated patients equally and allocate resources justly. Doctors should never practice cost-effective medicine. Some examples there. So autonomy would be things like a patient's right to refuse a surgery, beneficence, giving patient pain relief, non-maleficence, avoiding unnecessary pain, and justice, organ allocation. Okay, so we've got an interesting scenario here, which is something that could potentially help you in your interview if you have a practice to this kind of question. So Stephen, age 70, has been brought into hospital by paramedics following heart complications. Whilst being admitted, he suffers a cardiac arrest. His team of doctors went to administer CPR. However, they found the letters DNR tattooed across his heart. As his doctor, what should you do? So when you're answering this question, you really want to think about autonomy, beneficence, non-maleficence, and justice. So as you're thinking about these things, feel free. I'm just going to give you kind of 30 seconds to a minute to have a think about some points you might want to bring up when you're answering this question. And feel free to put them in the chat, and then we can have a look at what people have said. Okay, so hopefully you've had a think about some of those medical ethical pillars and how you would bring them into your answer. I can't see anything in the chat, but I completely understand if you're a bit hesitant to put your ideas forward. But no worries if that's the case. So, in terms of thinking about this answer, there's a couple of things you might want to touch on. So, we have a dilemma here. Are we honoring a patient's wish and saving their life? But you might want to consider, would a DNR tattoo be valid? So in the UK, a tattoo is not legally binding. However, following a patient's wishes is a vital part of autonomy. He is unconscious. However, would the tattoo still accurately represent the patient's wishes at the current time? In the situation, we saw that he was 70, so this could be an outdated tattoo. He might not have wanted to get it in the first place. You would need to act fast. Critically. So, like we said, you just want to be able to talk through your thought process. That's not to say there's an absolute right or wrong way to answer this question. But you'll really benefit from touching on those principles when you're talking through your answer. Okay, so the role play scenario. During your interview, you may take part in a role playing scenario. So this could be medical or non-medical scenarios. So they're used to test your verbal and non-verbal communication, as well as seeing how fast you react to unknown situations. So this can range from explaining a concept to a patient, diagnosing a patient, explaining, explaining a mistake that has been made, or breaking bad news. So, in terms of tackling the role play scenario, they can feel intimidating, but they are one of your best chances to show off your skills. So, whether you're an aspiring actor or not, these are a few tips that can help you tackle them effectively. Firstly, understanding the role and goal. So, what qualities are they assessing? What is your role and responsibility? Communication. Have you introduced yourself? Are you actively listening? Are you making eye contact with the actor? And are you speaking slowly and clearly? Using a calm and structured approach. Some of these we've already spoken through. And practice, practice, practice. So the more you get used to being put under the spot naturally, the easier it's going to become. So just to answer some frequently asked questions, what should you wear? You want to dress smartly and appropriately. So be comfortable but professional. Will you have to act during the role play? No, you will answer as yourself. What if the time is up mid-answer? Don't worry, the interviewer is always going to be aware there's time pressure. They will have been able to give you an appropriate score within the time available. Who is it interviewing you? So it will be a combination of academic staff, lecturers, admissions team, healthcare staff, current medicine students, and general university staff. That's not to say every single one of those people will be there, but it will be a selection from those categories. Some of that less relevant if you've got an online panel interview. Okay, staying calm. It's really important to bear in mind that interviewers are there to get the best out of you. So they want to see you do well. And if it feels like they're asking you extra questions or probing, it's because they're trying to get the best performance possible out of you. However, sometimes you may give an answer where you've provided enough information quickly. So please just don't fret about the length and time of your answers or how many follow-up questions you're being asked because it'll vary. But just do bear in mind that they do want the best out of you. It's in your best interest. I also think it's nice to hear that although most of you won't be doing the MMIs, we do get really positive feedback from applicants about the MMI process and how welcoming the atmosphere is at Newcastle because they want you to be relaxed and to feel comfortable to answer questions. It's okay to take a breather. If you just need to take, 10 seconds to kind of get yourself together, there's absolutely no shame in that. But do think about your body language and your tone of voice and how clearly you're speaking. Make sure to introduce yourself when going into your interview. And do not stress about the interviewer using up too much time. The interviewers are all aware of the time constraints of the sessions and will be asking you questions, like I said, to get the most out of you. Okay, so just some final top tips. You want to reflect on your skills and please don't be afraid to bring in your hobbies. It's really important that you don't feel you just need to be answering questions about medicine, talking about medicine experience. Your hobbies can be so valuable. For example, if you've ever played a team sport, think about how you're demonstrating teamwork, commitment, time management, organization. If you play an instrument, the same thing. Interviewers are all, looking for students as well that can contribute to wider student life at university. It's not all about your degree. Make sure you've read up on current medical and dental issues. Stay calm and listen to the question to make sure you fully answered what is asked of you and you're not just assuming. Prepare early, of course, but you're all here, so that's helping. Just some common mistakes to avoid that have been passed on to us from selectors. So these are things they've noticed in applicants that don't get offered a place. It might be lack of research, so not having enough current up-to-date knowledge on medical issues. Also, potentially lack of research about the course itself and the implications of studying medicine and dentistry at university and what that actually means, as well as the career. Focusing on achievements and not reflection. I've said this loads, but There's no point talking about your work experience if you can't mention what you've gained from it and how it's going to help you be a doctor. So just think about those core transferable skills. And my advice would be prepare some examples for each skill, because that will really help you. Like we said, two rehearsed answers, so you don't want to come across scripted and robotic. I know it's a hard balance when you're also trying to prepare, but try and keep your humanity. They know you're a human being. They want to see that you're a human being. A lack of personal experience kind of links into this. So reciting an answer you've seen someone else publish on the internet isn't going to do you any favors. So bring in your personal touch and why you actually are passionate. Neglecting ethical awareness. So hopefully, if you weren't as understanding about that, you do know now because we've touched on those four pillars and how to bring them into your answers. And an unstructured response. It's so easy when you're being asked an interview question to launch into an answer. But usually that means it'll be unstructured and you'll probably get halfway through and you'll think, oh no, I've missed out something that I should have said 3 sentences ago. And it can kind of fall apart a bit. And it's so understandable. Like I've definitely been guilty of that in interviews. You think, you need to answer the question right now, and you start going, and then you're like, oh no, this wasn't the structure I should have followed. So just take a second and get that situation, task, action, result format clear in your head before you start speaking. And of course, don't panic. Just take a second and start again. We're humans, you're humans. It's not the end of the world. Okay, so enough of me yapping on at you. We're going to have a look at some practice questions. So, question one is, why have you chosen to study medicine at Newcastle University? And we're actually going to hear from one of our student ambassadors, Beverly. Beverly, if you want to come into the come into the room.
Oh yeah. Yeah, so my
So
name's
if
Viv.
everyone on the webinar wants to just take kind of 30 seconds to think about it, and then Beverly's going to give us an example answer of why she chose to study medicine at Newcastle. Also, Beverly, feel free to like introduce yourself.
Yes, yeah. So my name's Viv. I'm a third year med student and I'm from Northumberland.
Okay, Beverly, are you ready to share with everyone why you chose to
Yeah, of
study
course.
medicine at Newcastle?
So one of the large reasons I chose to study medicine at Newcastle specifically was because of the style of learning they use. There's different types. There's traditional learning, there's PBL, and there's case-based learning. And Newcastle does case-based learning, and they're like very big on that. And that's just something that I knew would work for me personally. And by case-based learning, I mean that they kind of tend to separate it into conditions and body systems. So if we learn about diabetes in first year, then we're going to do the anatomy of everything to do around that, and the pharmacology and the drugs and everything about that will be covered, rather than doing like the whole of the anatomy of the human body for like the first month or so. So I found that really helpful just because I knew that I think I would really struggle to put everything together and kind of remember and link these things if I was taught everything in one go. And to be honest, that's proven really well for me in clinical years so far, as I've been able to kind of recall conditions based rather than systems based. Another reason I chose Newcastle was the area itself. I'm from Northumberland, it's quite close to it. And I think that's another really important aspect of university is choosing where you're going to live, especially for medicine. It's such a long degree, you're going to be there for 5 years. I think it's really important to think about the city that you're choosing to live in and the area surrounding it.
Amazing. Thank you so much. So I hope you all found that useful. That was a wonderful response from Beverly. Um, I hope you noticed what was really nice was that she spoke about the teaching style. So it's really good going into your interview if you know the specifics of the university you're interviewing for. Obviously, they all do approach the teaching style quite differently. So if you've proved you've done your research on the teaching style, that's a winning point. Um, Also, what's really important, which you might have neglected to think about before, is talking about the city. Like we said, selectors are interested and applicants are going to contribute to wider student life, get involved. Newcastle's obviously a fantastic place to live and study. So it's nice to show that you're also interested in living in that area and being a student there. Okay, so Next question. So, our next question is discuss a current dental or medical issue, based on what you're applying for, obviously, you find interesting and explain why. So, again, I'm going to give you 30 seconds to think about it, and then I'll invite our next student ambassador to answer for us. Okay, Malika, do you want to introduce yourself and then just go ahead and answer that question for us?
My name is Malika. I'm a fifth year dental student here at Newcastle. And yeah, this is how I'd answer this question. So, a current dental issue that I find quite interesting is the increasing use of digital technology and artificial intelligence in dentistry, especially when it comes to diagnosis and treatment planning. As the years have gone by, dentistry is becoming more data driven with tools like intraoral scanners, even AI assisted like imaging analysis, or even like AI note templates being introduced into everyday practices. But what I find interesting about this is how these technologies can improve diagnosis and early detection. For example, some AI systems are now being developed to help identify decay in teeth or bone loss from periodontal disease or even signs of oral cancer on radiographs that might be subtle or easily missed by a dentist, for example. And I feel like the earlier that detection happens, it can lead to more conservative, effective treatment because it's been spotted earlier on rather than later. Um, but I think it also makes it interesting because whilst technology is really good at helping this, dentists are still necessary because it can't replace clinical judgment. They still need a strong understanding of anatomy, pathology, and the patient history and what the patient's like to interpret these results appropriately to be able to communicate these findings clearly to patients, which AI can't do by itself. I think this emphasizes the importance of kind of training and critical thinking, especially since dentistry always is constantly evolving. Um, but it does also have the potential to create more of a gap between NHS and private dentistry. So it kind of needs to be integrated in a way that can benefit all patients rather than creating an unfair advantage. As a prospective dental student, if I'm pretending I'm a prospective dental student, this issue interests me because it combines science, problem solving, and patient care. Um, it reinforces the idea that dentistry is always constantly evolving, and I'm motivated by the challenge of developing strong clinical foundations whilst also embracing innovation, continued professional development, so that I can provide high quality, evidence-based care in the future.
Thanks, Malika. That was a fab response. I think what's really nice there, your genuine interest came across. Really in detail response, linking both your awareness to the issue as well as why it interests you to pursue dentistry. So I hope everyone found that helpful. Okay, next question, a more general one about our one of those transferable skills that we talked about, teamwork. It comes up all the time. So very simple, but tell me about a time you've demonstrated good teamwork. So have a think about it, and then I'm going to invite Gaff from Dentistry, our next student ambassador, to answer it for us. Okay, Gaff, do you want to introduce yourself and give us an answer?
Sure. Hi guys. I'm Gaff. I'm a dental student. I'm in fourth year. I'm from Milton Keynes. I'm currently studying at Newcastle University, and I work at the dental hospital. while I'm just learning to become a dentist. So if I was doing this question as a prospective dental student, this is how I'd answer it. So a time that I've demonstrated good teamwork would be when I was doing some dental work experience. So while I was doing this with some of my friends who also wanted to apply for dentistry, and we were sort of at a dental clinic as a group, and we were given a task to be able to clean down a bay. So the bay was sort of emulating what a bay might look like after a dental procedure. So it had some stuff like clinical waste, so stuff that the patient might have touched, a patient bib, tools that would have been used on the patient. Then it would have things like sharps as well. So, probes, burrs, that sort of stuff. And then we'd also have stuff that actually hasn't been used. So let's say unopened tools and other things that just hadn't been used. Obviously, we don't want to waste that. So we were given the task as a group to be able to clean down the bay. And initially, I think all of us were quite flustered because a lot of it did look quite intimidating. However, we decided after a bit of sort of hesitation to be able to divide ourselves into groups and sort of focus on one particular section. So, for example, I was tasked with dealing with the sharps. So, what that meant is making sure to dispose of things in the sharp spins and making sure that any clinically or any sharps that have been contaminated were disposed of correctly. And then my other friends were tasked with getting rid of things such as the clinical waste and also taking stuff that hadn't been used back to clean utility. So this experience highlighted to me the importance of teamwork. Obviously, in a dental clinic, you've got a lot of sort of moving parts and you've got a lot of people to deal with. So nurses, dentists, patients, etc. So working as a team will make it run far more efficiently. And I think that's what I learned, how important teamwork can be and how important it is to sort of be cool and collected in the moment. I think the one thing I did take from it as a sort of learning point is to stay composed. So at the beginning, I mentioned we were quite flustered, but I think if we had sort of been composed from the beginning and communicated with each other a bit more clearly, then we could have got to the decision that we made a bit earlier.
Thanks, Garth. That was fab. I'm sure everyone recognized there that was winning response. Um, fantastic demonstration of that star format as well. Really clearly laid out the situation, explicitly mentioned the task, the action, and result, and then reflected nicely on why that's important for being a dentist. And also what he would do differently in the future, which is extra points. So well done. Well done. You're in. Hope everyone found that helpful. Okay, now it's your turn to ask our student ambassadors some questions if you'd like. So feel free to suggest some questions. I think suggest them in the Q&A box, not the chat box. And I'll pick a couple for our student ambassadors to answer. If you are lacking inspiration, there's some here. So if you could type out some of these if there's one you particularly want to hear answered. But yeah, if you guys have any ideas of questions you want to hear like a good answer for, feel free to stick them in the chat. The Q&A, sorry. The Q&A, I think. Okay, I've navigated myself to the Q&A box. So I'm going to pick a couple of these for our student ambassadors to answer. So, Malika, I'm coming to you first, if that's all right.
Yeah.
So, could you answer the question? Obviously, also feel free to take a minute if you want to prepare your answer a bit.
So I'm
What
just
do you
trying to
think?
put my camera on.
Oh, don't worry. What do you think is the biggest problem NHS dentistry is facing today?
Oh, if my camera wants to turn on, sorry. So I think one of the biggest problems within NHS currently is
the way the contracts are run. So the way that NHS contracts currently work is called, oh, is that, yeah, okay. It's
You're in.
called units, UDAs, called units of dental activity. Um, but the way that works is that if a certain dental practice, an NHS dental practice, doesn't have enough activity going on, there's things called clawbacks. So just say you're not reaching enough targets of activity, it might actually be that the practice is required to pay back to the government certain amounts, which means that dentists aren't really getting paid fairly. Because if you don't complete a course of treatment or a contract, then you don't get paid. So just say like 6 fillings would be the same price. It's all under the same for whether it's 1 filling, 8 fillings. So that means that it's quite tricky, and it's not very sustainable because also since COVID, there's a massive backlog in appointments, um, which means that it's really hard for people to get appointments, which you hear all the time from patients saying that they can't find an NHS dentist. It also means that there's very short appointments, and you're kind of balance out your quality as well as your time pressures because you want to give the highest level of care you can, but you also have to be efficient. And sometimes that can be a compromise, which is why a lot of dentists might feel pressured towards to go a bit more private work. So I don't know if that made sense, but yeah.
Fab, thank you. Yeah, very well developed answer. I hope that was helpful for whoever asked that question. Okay, Beverly, I'm coming to you next.
Fab.
So a couple of people have suggested they want to hear an answer to what is your biggest weakness. So how would you answer that question?
I think at the time of applications to medical school, my biggest weakness probably would have been kind of my fear or insecurity about public speaking. I think that was something that was like a really huge anxiety for me, at least at the time of applications. And I knew that being a doctor, leadership and qualities like teamwork, they're also highly valued, but it's also completely acceptable to have flaws and have things you're not so confident on because all of these things can and will be worked on. As you just get older, but also go through medical school and get trained on how to do these like activities and tasks. And I think just this question is kind of designed for you to reflect upon yourself. And it's not saying that, oh, you should have no flaws, because that is, if there is a wrong answer, it's saying that you'll have no flaws. What they're looking for is just, okay, so you found something that you struggle with, whether that's public speaking or self-confidence or time management, and then you kind of show how you've worked on that. So at the time, I knew that I had a bit of fear of public speaking. So what I did was I did an EPQ, and knew that I was comfortable with the research side of it. And then at the end, I presented it because that's just part of the mandatory thing you do in an EPQ. And I found that that really helped challenge me in an environment that wasn't too scary because it was still my peers and people that I had known, but was still somewhere where I had to actually do public speaking. So I think it's really just about showing the fact that you're willing to work on that flaw and there are ways to build your confidence and work around it.
Thank you. Yeah, that really lovely advice there. And I think it's very important to remember that you can turn your biggest weakness into kind of a strength in the way that it's something you've reflected on and you're actively trying to improve. So obviously when you're answering that question, you don't just want to be like, I'm really disorganized. But it's also important to be honest and say like, whatever you're struggling with, you've come up with like a proactive plan to kind of mitigate that and make sure it doesn't affect your workflow too much. But also, like I said, be honest and come across human. Um, okay, Gaff, I'm coming to you next. And I'm gonna ask the question of how would you contribute to the student community if you were offered a place here? Because a couple of people have requested that one be answered.
So I think that's a really good question because in interviews it's very easy to sort of be hyper focused on dentistry and medicine and the university as a whole, and just focus on the academic side of things. But I think it is really important while you're at university to make the most of the sort of opportunities that you have because a lot of them you won't ever get again. So I think the first thing that I would recommend to basically everyone is to try and get involved in as many societies as possible. So when I first came here, I wanted to carry on playing some sports that I had sort of done at school. So I was quite a good tennis player, and I sort of carried that on here at university. I'd been going to the gym. I'd started in secondary school, so I kept going here to the university gym. And then there was a couple other things that I wanted to try. So I used to kickbox back in year six. So I wanted to pick that up just because I feel like at university, everything is so accessible that it really doesn't make sense to not at least give it a try. And if you don't like it, you don't have to go. So I think that's a really good thing to try and get involved in. Not only for the sort of benefits of being able to do a physical activity, but also for being able to kind of find a community and find people like yourself who are like-minded, share the same interests, who you can speak to. And I think that's really important, especially as dentists or future dentists and doctors, because once you graduate, you will be, working quite a lot of hours. You'll be seeing a lot of patients, and it can be very stressful. So if you can sort of get into a good routine of having stuff that kind of takes that stress away outside, then you can carry that on into the workplace. And that's really good, I think, for being able to manage stress, avoid burnout once you start working, because it will be stressful from time to time. So I think that's probably worthwhile getting involved in.
Thank you, Gav. Yeah, I think that's really helpful advice. Really nice as well, linking it to how that's actually will still help you as a dentist, in the sense of if you've got other hobbies, if you've got things going on outside of your course, you're less likely to get burnt out. You'll maintain that perspective, keeping different friendship circles as well. But yeah, I would say for that question, you can definitely mention student societies. So these are student-led groups. We've got all kinds of societies at Newcastle, over 160. They range from things like baking to esports, sober socials. There really is a society for everyone. So any kind of indication that you'd be interested to try something new or start your own society, even anyone can start a society, as well as sports clubs. So yeah, we've also got over 60 sports clubs. So if any of you want to pick up a sport or carry on your sport, that's a really good way that you'll be contributing to the student community. Other ways you could get involved in the student community would be learning a language. So we have language learning facilities at Newcastle. So whatever degree you study, you can pick up a language on top of that for free, which is a great resource. We also have the student media. So if anyone was interested in kind of writing for the student newspaper, hosting a radio show, or creating social media content, that's also available. And also volunteering opportunities. So we have a Go Volunteer scheme where you can get involved in projects in the city. So these are all things you could have a look into, and maybe prepare some answers. Okay,
Can I add one thing? Sorry.
Yeah, of course.
Specific to dental, there's a dental volunteer outreach thing called Brush Up. So just top tip, that can be a really good thing to mention. If you look it up on our socials, I think it's Brush Up Newcastle NCL. That's a lot of outreach things, like going out to primary schools. There's kind of like outreach buses, care homes, asylum seekers. It's like a really good thing to get involved with. So that could be another thing that you mentioned that's related to dental as well.
Yeah, no, that's some really helpful advice. Thank you, Malika. I think I'll just ask one more of these questions actually, because it's come up a lot in the Q&A. So Bivoli, sorry, I'll come back to you one final time.
No problem.
And I think just because it's such an important one, what do you think is the most challenging aspect of being a doctor?
I think something that I definitely thought about before I applied, and something that I still do think about occasionally, is the time management aspect of medicine. And as a career, it's something that even as a degree I thought was going to be so time consuming, and I was really concerned about that. But then obviously the reality of being a working doctor in the NHS is like you hear a lot of stories about how little time they have. And I think while that is certainly hold true, the fact that yes, doctors are incredibly busy, yes, they do work long hours and long shifts. I think it's not so much the fact that you can't do anything, it's more about time management and making sure you have that skill sorted, because you've still always definitely in university got the time to do the hobbies and see your friends and have the social life you want, as long as you are able to prioritize things at different times. Of course, when it comes close to exam season, you tend to put a bit more time revising, And then as those kind of ease off, you're welcome to go back to your hobbies and your social life and everything. And then actually working as a doctor itself, I think it's really important just to remember that there are a lot of doctors out there already who are living their lives and having fulfilling lives already while being a doctor themselves. I think it's really important to kind of, if you can, to talk to people in healthcare, whether that's people in your own family, if you just listen to like talks done by doctors themselves about how they have managed to sort out the career and the work-life balance that has been the issue that people have been talking about for so long.
Amazing. Thank you so much. And I hope everyone who was asking for that question has found that helpful as a response. Okay, there are loads of amazing resources where you can find out more information and which will help you prepare even more for your interview. So if you go on YouTube and you go study medical sciences NCL, there is a whole host of resources on there. From videos talking about how the medicine course is taught, to facilities tours of dentistry and medicine. You can watch vlogs of students on placement. And yeah, it could be really useful insight for you guys both to have a look at Newcastle facilities, but also prepare some content that you could bring into your interview to show you've done your extra research. So, highly recommend having a look at that. Okay, I know we're not fully at the end yet, but I think it would be interesting just after that, if we can answer this poll again, how prepared we feel for the interview. So I'm just going to clear the responses. And then if everyone wants to go back onto Mentimeter, I think it should be the same code. Yeah, 671997977. See if anyone's feeling a little bit more prepared. This is good to see. Our bell curve's definitely shifted up. It's really nice to see the majority of you now in that kind of 7 to 9 category. I wouldn't expect us talking at you for 45 minutes to have suddenly made you feel completely confident, but hopefully you have found the information helpful. That's really nice to see. So question time now. We're staying on the webinar until 6. So feel free to keep asking your questions. We have got our student ambassadors here, who are here to help answer them. So I will fire some more questions at them from the Q&A. I also thought it'd be nice if you guys could go around kind of starting with Bivoli, just talking about how you have found your experience overall, just a brief summary of kind of your highlights of studying medicine / dentistry at Newcastle.
Yeah, absolutely. So, I think for me, years 1 and 2 were quite similar, just in the sense that all my teaching was on campus. Like it was quite similar to other university degrees, just in the sense that you've got lectures and seminars, and it's just the content that's like very medical based. And a highlight of that was definitely the fact that it wasn't that different from other degrees. I had quite a lot of friends who weren't in medicine, and I felt like I could certainly kind of do the same things they did and had kind of similar times off and the same schedules, but mine was just to tend to be having a bit more lectures. But third year has definitely been the most interesting year. It's the first clinical year. So all my teaching is now done in hospitals, and it's a lot more ward time and more interaction with patients, which is kind of what the degree is all about. I think that's just really shown me like what the career it really is and what my realistic life is going to be after I graduate. I think that's just been absolutely amazing.
Fab, thank you. Gaff, do you want to give a little overview? And also, Gaff, could you also just touch on what type of learning Newcastle University uses for dentistry? Because it's one of our questions.
Yeah, sure. So at the university, um, when we're learning at dental school, the first 2 years are basically all just lectures. So you have in first year, you have like a little taste of what clinics are like. So you go in and you do a couple clinical things, but you'll do them all on phantom heads. And that's really just to kind of remind you that you are doing dentistry, because most of the time you will be just doing lectures. So you'll be covering things like anatomy, cell physiology, and cell biology. Second year is when it starts to get a bit more clinical and a bit more tooth focused. So you learn more about the mouth, you learn more about how teeth develop, and sort of you learn more about microorganisms as well. But then the last term of second year is all just clinical stuff. So it's all about learning key clinical skills. So learning how to drill a cavity, how to then fill that cavity, how to access a tooth, and all those sort of things. And then third year to fifth year is where you're on clinics all the time. So all of our lectures from third year to fifth year are basically online. And that means that we can do those lectures whenever we want, which for me, I found is really good, provides me a lot of flexibility. Other people might want to do them in person, which obviously can be a bit of a downside for them. But for myself, I found it to be really helpful. And then other than that, it's about 15 hours of contact time a week in third and fourth year on clinics. And then you'll also be doing some learning. So in third year, we learn how to do a root canal. And that's sort of a separate course that we do on phantom heads with plastic teeth. And then in fourth year, we learned how to do crowns. We learn how to do crowns, things like bridges and veneers, etc. So the learning is sort of, I think, organized quite nicely, because it was very good to be able to learn all the stuff, then be able to put it into use on clinic. Other people might prefer earlier clinical exposure, but for me, I thought it worked quite nicely. And yeah, that's just sort of the way that it's structured here at the dental school.
Fab. Thank you, Gaff. That was really helpful. There are a lot of general questions kind of about living in Newcastle as a city. I'm happy to answer that. Obviously, I spent 3 years studying in Newcastle, and I still live in Newcastle now. You do find a lot of people finish studying at Newcastle and don't go anywhere because it is just such a great place to live. Newcastle is a really thriving, compact city. If you guys haven't been up there, I highly recommend you come and visit if you're able. So it's really walkable. So from the top to bottom, it's about a 30-minute walk. But within that, you've got obviously a thriving city centre, loads going on. 1 in 6 people are students at Newcastle because of Northumbria University as well. So within the city, there's just students everywhere, which means the whole city is really nicely set up for students. And as well as that kind of thriving city centre, you've got the quayside. So down by the river at the bottom of the city, there are markets there on a Sunday with loads of independent sellers. It's a really nice way to spend your weekend. We're also just like 25 minutes from the coast on the metro. So you can literally hop on the metro in the city centre. Student singles are £1 if you're 21 and under. And you can be at the beach. We've got some of the most beautiful coastline in Northumberland. So that's something I enjoy doing with my friends on my weekends. We'd go for a sea dip and a coffee in Tynemouth. There's more markets there as well. There's markets everywhere in Newcastle. So if you like independent businesses, you'll be happy. We've also got loads of little neighbourhoods. So we've got Ousbourne, Heaton, Jesmond, where a lot of students go and live. And they're full of like independent bars and shops and cafes. So yeah, the second and third year housing areas, when people tend to move out of halls, are really lovely at Newcastle. And yeah, we have just won the What Uni Awards for the best student city. And I'm sure all the student ambassadors would agree with me that it really is a very unique place to live and study. So yeah, I hope that helps answer kind of what it's like to be a student in Newcastle. Oh, it's also really affordable. So we're a top 5 UK affordable city. And it does mean a lot. Your money does go further. It basically means you can have more fun because you're spending less on the essentials, and therefore your money does go further. So yeah, thank you for that question. Seeing what else we can answer live. Gaff, could you answer this question? What do you believe are the most important personal qualities of a successful dentist?
Yeah, of course. So in terms of what qualities a dentist needs, I think the first one is empathy. So especially if you come to the Newcastle Dental Hospital, unfortunately, the Northeast does have worse dental outcomes than sort of anywhere else in the country. And that's just because of sort of socioeconomic factors and that sort of stuff. And there is just a greater level of deprivation. And so because of that, some of the patients that you see tend to have conditions that are quite disheartening. So it is really important to be empathetic, and not to judge patients, because a lot of patients also do feel quite nervous about coming to the dentist. So even a lot of adults really don't like coming to the dentist. And I think that's something that you have to be empathetic about. So I think empathy is probably one of the most important things that you can have as a dentist. I think the other thing is a team player. So you need to be able to demonstrate good teamwork, just because whenever you're on clinic, it's never really just you working alone. You have to kind of coordinate with other students, with nurses, all that sort of stuff. And that carries on into the workplace as well. So that's really important as a quality to have. And then I think another quality that's important as well is diligence. So that's about making sure that if you know that you have a complicated procedure tomorrow to do, so for example, let's say I had a root canal to do tomorrow, it's all about making sure that the night before or the day before, that I make sure that I've researched that and making sure that I know all the steps, so that when I go to clinic, I'm ready, I know what I'm doing, I know how to do it, so I can get the best outcome for the patient, the best outcome for myself, and so everyone kind of goes home happy. So I do think that being able to take accountability and being diligent for your own work is really important. And I think it's something that doesn't really get mentioned enough, but it will really pay dividends once you get to third, fourth, and fifth year.
Fab, thank you so much. Another really helpful response. Maybe got time for literally one or two more questions. Malika, I'm coming back to you. Sorry, I feel like I've neglected you in the Q&A. The others have taken the hit.
No, sorry, my laptop crashed halfway, so that's helpful.
Oh, really? Could you just answer, just speak a little bit about your experience at interview for Newcastle? Obviously, maybe don't go into the specifics of what you were asked, but just kind of your experience on the day and how you felt and everything.
Yeah, so my Newcastle interview, it was obviously a panel interview, but it was online because back when I applied, it was COVID times, which obviously is a long time ago now. Um, I think how I felt it was just genuinely like a really friendly chat. I think the main things that they wanted to see is that you're just a person that's able to have a conversation, that you're genuine, that you're friendly, that you can smile. Because at the end of the day, these are the qualities that potential patients will be looking in for you. I think you always want to act like the way you'd want your family to be treated. So you want someone that would be nice, friendly to you. So as long as you're genuine, you're kind, all of these basic skills that you need to be a dentist, I think that will really shine through. I think it's equally just as important to get your personality across rather than it just seeming like a robot with personal experience. Because at the end of the day, it's also about what you're like as a person. Um, yeah, I think also try not to have rehearsed answers because they might try and catch you off guard. I think it's really important to stay calm, because I had a question that I didn't really know the answer to, but what I could see through what the question they were asking me was that they were trying to get me to link it back to previous experiences and how that links to being a dentist. For example, like the importance of staying calm or always linking it back to why it would be useful as a dentist. So yeah, every question, just try and link it back to something that makes you good for dentistry.
Amazing. Thank you so much. I think it's really nice to hear that it does feel like a friendly chat. Hopefully that's reassuring for you guys. Such a valid point. In the end, these are patient and people facing career paths. So it's really important that you embody that kind of warmth and good bedside manner that's going to come across in your interview. So yeah, just remember to stay human. Okay, that is all we've got time for. Thank you so much, everyone, for coming along. I hope that's been helpful. Thank you so much to the student ambassadors as well. You guys have been great. And to Matt and Kim, who have been furiously typing away answers to your questions. I'm sorry if we didn't get through them all. But yeah, thank you very much for coming, everyone. Best of luck. Stay calm. It'll all work out. And I'm sure you'll all go and smash it. So thank you, everyone, and enjoy the rest of your evening. Bye.